Good day, everyone. I am Christine, the moderator for this webinar. I welcome everyone to today's webinar that is updates about emailing, texting, and use of professional devices by healthcare professionals, HIPAA privacy myths versus reality for 2025. I would like to introduce our presenter for today, Mark R. Brengelman. Mark holds bachelor's and master's degree in philosophy from Emory University and a Juris Doctorate from the University of Kentucky. Mark has worked for all three branches of government. I would now like to hand over the floor to the speaker. Over to you, Mark.
Thank you, Christine, for that excellent introduction. So good afternoon to everyone on Eastern and Central. Good morning to everyone on Pacific and Mountain Time. We are going to have this as an updated webinar today about emailing and texting. We will cover the basics of HIPAA privacy, the use of electronic communications, some examples of state licensure laws, because that's going to be an even bigger key now moving forward. Elements of privacy notices and communications with patients. We will talk about personal devices, texting, and emailing. As a bonus, we have website confidentiality and privacy disclaimers for the healthcare practitioner and updates for 2025 under the new presidential administration. I think it's important to have some disclaimers here about what this does and does not cover, provide a broad overview of HIPAA confidentiality and electronic communications issues. Does not cover everything about HIPAA. We know that HIPAA is the federal right of privacy, but confidentiality also involves state law privacy rights, and we have two kinds here because we have general healthcare privacy rights and then also data protection privacy rights. HIPAA was effective 20 plus years ago. You know it covers protected health information and it can include business associates. Health information, this is a more definition of protected health information. There's implied consent for insurance filings, billings, other kinds of implied consent. Express consent, there are exceptions to confidentiality. So healthcare professionals and their patients communicate among themselves and with each other by devices. So why use texting and email? This is a little bit of an old citation, but texting is quicker. The response time is quicker, not only a heart rate monitor, but other kinds of monitoring devices. So the preferred communication method for most young people are texting and the use of social media. Cellular telephone ownership, like 95%, smartphone, 75% ownership. Among Americans 18 to 49, it tops 90%. So how can you best use texting and email? You identify and use a secure communications platform and a patient portal that would govern messages and texting. The communication platform you can use is HIPAA compliant as to digital security, meets security and data storage needs of the healthcare professional. Many people use and prefer text and social media to phone calls. They are seeking more immediacy in their communications. Remember, any communication between healthcare providers and patients must be conducted in a HIPAA-compliant way. The HIPAA privacy and security rules mandate covered entities use those safeguards when emailing or texting. Use electronic communications, you have to secure the transmission. What are encrypted email systems? Are text encrypted? Those are ones that would have at least two-factor identification. What about texting? Texting can be an acceptable method of communication. The same data security rules and practices apply. You have to use encrypted texting systems to secure the transmission. Texting can be an acceptable method of communication, even with using protected health information. Remember, HIPAA does not apply to patients. It applies to covered entities. So patients can always send the healthcare provider their protected information. That doesn't necessarily mean you can respond. The provider may instead instruct the patient to use the secure patient portal or to call the office and make a patient appointment. Use reasonable safeguards. Patient communications be included in the record. Here is a telepsychology and telepractice record-keeping requirement about what confidentiality applies in telehealth and telepractice electronically. With electronic practice and telepsychology under this example, these people are mandated to use secure communications, including encrypted text messages via email. So what about charging a fee if you're going to be communicating back and forth? So with regard to HIPAA as applied to electronic communication, here are some suggestions for you if you are an employer. Do apply those kind of policies to the entire workforce. not only healthcare practitioners, but any employee communicating with a patient like an assistant, receptionist, secretary. Have your interdisciplinary team review all of the employment policies, consider the security and risk prevention. From Law 360, this has a little bit of age on it. Even if the specific act of texting information about the patient was not authorized, the medical assistant's misconduct occurred while at work and was sandwiched between other authorized functions. Here's another case. Hospital's trial win okayed in suit over worker's Facebook post. So what about state licensure boards and agencies? How do state laws apply to violations of confidentiality? What about website and privacy suggestions, like a website's contact me page? For privacy notice and procedures, if you are going to use secured and encrypted email and texting, you certainly would want information on alternative means of contacting the client other than electronically, and inform the client about the limitations of that technology. General sample privacy notices. So some takeaways. Review the ways your staff may use cell phones. You need to cover the essentials that you need and include in your HIPAA policy concerning smartphone access and usage. Data sharing agreements would cover personal internet use and business internet use for personal. Remember, state licensure laws, professional codes of ethics, and the concept of confidentiality should be firmly ingrained in healthcare professional psyches. This president is likely to have more industry input and more business-friendly approaches to HIPAA. The new president signed multiple executive orders. An executive order is a directive to a federal agency, what regulations are in the pipeline that need to be stopped and whether they would go forward, and to consider postponing regs that are in the 60-day notice and comment rulemaking. So it just basically is starting over with regard to 60-day notice and comment rulemaking. Following the postponement of those, the Office of Management and Budget and the President will decide what further steps could be taken. With regard to the federal landscape being very uncertain at this time, we are going to have to look to state law privacy rights. Data, like in your smartwatch, is not covered by HIPAA. Washington, Nevada, and Connecticut passed laws with regard to HIPAA, which applies those laws to regulated entities of business that conduct business in Washington. In contrast, the Nevada health policy law narrowed the definition of consumer health data. So HIPAA is not new. The basics of HIPAA should be routine. So I hope we've covered the basics of HIPAA privacy. Thank you, everyone, and be aware that the existing HIPAA confidentiality rules are in place until the new administration promulgates new regulations that change that or that repeals existing regulations that take them off the book. We will have to just wait and see. So thank you all very much for holding out with me as long as my voice held out. I am spent. Over and out.
And thank you, Mark. That concludes the sessions for today. Thank you, everyone, for participating. You may all disconnect now and have a productive day.